I'm Tiffany Jones. Welcome. OneLegacy Educational Town Hall Series is set to provide knowledge, empowerment, and address health disparities in the diverse communities that we serve. But first, I just want to say I appreciate all of you for tuning in. For those of you that are recurring participants, we are happy to have you back. And for those of you that are new, welcome. And I want to highlight that this month, August, is National Minority Donor Awareness Month. This month is extremely important as data shows us that minorities make up nearly 60% of the people in need of a transplant. So in this forum, it is key that we'll discuss bridging the gap, how to do that, and our panelists today will discuss the current needs in the minority communities. Then we'll also follow up with a call to action. So we'll tell you what some of the problems are, but then we'll give some action steps that we can all take. I will be turning it over to Marion Shuck, who will host this discussion. Marion is the Director of Donor Family Services and Community Outreach for the Gift of Hope Organ and Tissue Donor Network, while currently serving as the President of the Association of Multicultural Affairs and Transplantation. She will be joined by Amy Waterman, Professor in Residence at UCLA Division of Nephrology, and Deputy Director of Transplant Research and Education Center for the Terasaki Research Institute. We'll also have the privilege of being joined later by a special guest, OneLegacy Ambassador Jelani Polk, whom this conversation is deeply personal because Jelani is a two-time kidney recipient. And we believe that it is imperative to have people a part of the conversation that's directly affected by the topics we are discussing. We will have Q&A feature throughout the town hall, so please feel free to submit your questions and answers. Your questions, and our panelists will answer them as they go through. And if there is nothing else, I am going to turn it over to you, Marion.
Good afternoon, everyone. Thank you, Tiffany. I'm so delighted to be here today to be your virtual host and have this conversation about a couple of things, as Tiffany mentioned, National Minority Donor Awareness Month. We're also going to talk about the waiting list. We're also going to have subject matter expert Amy, and we're really going to be talking about how do we bridge the gap, diversity and inclusion in healthcare. And so with that, I'm excited to get started. And so let's jump right into National Minority Donor Awareness Month, one of my favorite topics to talk about. As we talk about National Minority Donor Awareness Month, it was created to be able to honor the contributions of donor families, honor the contributions for the transplant professionals and the surgeons and the doctors and the nurses and the coordinators, and really just honor donor families' contributions for minority communities, because oftentimes people will say, oh, well, the minority community won't donate. It's not that they won't donate, it's that we haven't framed the conversation in a way that is comfortable for them to donate. And so the MOTEP Foundation and Dr. Clive Callender developed National Minority Donor Awareness Day. Then it moved into a week, and now as of 5 months ago, we moved it to National Minority Donor Awareness Month, because we recognize that there's not just one minority community. There's not one multicultural community. And as we talk about our communities, we expand upon African Americans, Hispanic, Asian American, the LGBTQIA community, the Muslim community. And so we have lots of communities that are helping support organ and tissue donation, and who will willingly give if we as a community are mindful and intentional of how we create a positive culture for donation, not only in hospitals, but in the communities, as we all do, to be able to provide that education and outreach and really help families understand the process of donation. And so I'd like to just say, you know, as we talk about this and we talk about people who are waiting, we just have to really recognize that for anyone that experiences a tragedy, you want to be able to help them, because that's the worst day of their lives. I can tell you, a year ago, it happened to me. My husband and I were out riding a bike and having a great time, and then all of a sudden, he fell off his bike, he'd had a heart attack. And so his life was not sustainable. But because I work at Gift of Hope, I understand organ and tissue donation. However, at that moment, I was not someone who worked at Gift of Hope, I was a wife. And I had to come to the understanding that my husband's injuries were not sustainable. And so just imagine if you have to be in that situation where you don't understand the process of organ and tissue donation, you have to make that decision. And so it's very difficult, I can tell you. That whole period is like a blur. So really have the conversations with your loved ones. Tell them what your wishes are. Because as we segue into this, Jelani is really going to talk in a little bit. Thanks, Jelani, for joining us. He's going to really talk about what it's like to be a person who was waiting, what it's like to be a person who has received multiple kidneys, and he'll tell us about his experience. But right now, I'm just going to give you a little bit of information on the waiting list. And today, we have about 110,000 people waiting for a life-saving organ transplant, with kidneys obviously being the majority of that list, with 60% of the people who are on that list are waiting for kidneys. And then when we talk about who are waiting on that list, it's really 60% racial ethnic minorities who are waiting for life-saving organs. 29% of those people are African American, 21% are Hispanic Americans, and another 10% are Asian Pacific Islander and Asian Americans. And so it's really, incumbent upon us to really create practices that, help these families. Because think about this, 30 years ago, there were 10,000 people on the waiting list. Today, we have 110,000 people on the waiting list. So that's because a lot of things have changed, our lifestyles, our exercise practices, and the increase of chronic illnesses. So we want to make sure that we're having these conversations in a way that supporting families, supporting recipients, and just making sure that we all have these conversations with our families. And because we know that the need for donation is more pronounced in these minority families, we need to do more. And so as a community, we can do more. And so now I'd like to talk a little bit to Jelani. Thank you for joining us. As we mentioned earlier, he's our special guest, and he's going to talk about his experiences with receiving multiple kidneys and what it's like from having two separate kidney incidences, right? A deceased donor and then a living donation. So Jelani, thank you for joining us today. Can you please share your story with kidney failure and as a kidney recipient?
Sure, and thank you guys for having me on. It's nice to see you again. Can you hear me fine?
Yes.
My first transplant, I was basically, I was told I had hypertension, and it was an excessive number. They, during the initial meeting with the doctors, they said if you were a middle-aged man, you'd either have a heart attack or stroke or some kind of organ failure. That's how high your blood pressure is. Now, I didn't know anything about blood pressure. I just knew, I heard the adults in my family talk about this. At the time, I was only 13 years old. And so that began a very long process that culminated around my 21st birthday, where I had to be admitted into the hospital with not only renal failure, congested heart failure, and lung failure, respiratory failure. That was a traumatic shock for me, because as a young person, you think you're invincible and you're going to live and do all these amazing things. And at the time I was an athlete, an aspiring athlete, and I had all this potential, but suddenly it was taken away and I didn't know what to do. Going through the process of dialysis was very difficult the first time. The only thing I knew about dialysis was my grandmother had died from it, and my family never talked about it. So there was this additional layers of fear, the unknown. I don't know what to expect, and it kills people. But I moved forward as best I could. And after about 5.5 years of trying to find some footing, I found myself in a place where I just couldn't wait any longer. I didn't know what to expect next. And so I actually made arrangements on my birthday, and I was headed to Las Vegas. I didn't want my family to see what was happening anymore. I felt like, not that I was letting them down, but they didn't deserve to witness what was happening. They had already been through an experience, with someone else in my family. And so as I made this arrangement on my birthday to travel out of town, basically I was giving up. There was nothing else left for me. It was just me in a room with four walls. And that's not a life. And at least the way I was approaching it. And so after getting ready to go, I got a phone call, and there was an opportunity in that phone call. And they said, would you like to receive the opportunity to receive a transplant? And that's what organ and tissue donation is. It's saying yes to the opportunity that if we could help somebody, would we be available? And I had nothing else. There was nothing else left for me to go on. And so I went through the process. I received the transplant. It worked wonderfully for 4 years. I don't regret a single moment of it, but something didn't go right, and we couldn't figure it out. And that kidney, while I was very lucky to have it, my body eventually rejected it. And so I went through a bit of disappointment. And then I was told some really devastating news that I wouldn't be able to receive another one. They said I was 97% reactive towards other individuals' antibodies. And so, armed with that new information, I just couldn't accept it. The same day that they told me, you can't get another transplant because to us, 97 is like 100. Something inside of me, it just said, no, there's more you can do. And so I was able to find a hospital program, a transplant program that actually dealt with individuals that had sensitivity issues. And they're here in California. I was prepared to move out of state, leave my family, which is kind of hard. I'm a father of 5. But I just knew I needed to stay around because my focus was my family. Earlier in the first transplant, it was my brothers and sisters, watching them graduate and have kids and all the life achievements. I'm the oldest. Then in the second transplant, my kids, my own family. And so I did things a little bit differently. I educated myself. Exercise. I was exercising while I was on dialysis for the second time. And my doctors couldn't understand. They're like, your lab work says you're sick, but we don't see a sick person in front of us. And my outlook, my attitude, it wasn't somebody who was stuck in a room with 4 walls. I had all this life. I know I was, left for me to live. And so with the second transplant, I was able to receive a kidney from a living donor. And that was game changing. But my attitude and my perception about the fears and the uncertainties, even after a major disappointment, was an entirely different experience because now I had armed myself with the help of other individuals with this information. I didn't do it alone. This story is not about me. It's about those other individuals who helped me and guided me and provided me with the information necessary to keep moving forward. So it's not just one person's will, it's finding those individuals with the resources and that can impart upon you the understanding that, yeah, things are tough, but we can find a way forward.
Awesome. And so, that's the interesting thing is that even though a record number of nearly 40,000 people, including more than 18,000 racial and ethnic minorities, received the gift of life in 2019, the gap is still staggeringly high. And on average, 20 people die every day waiting for a transplant. And what people don't understand is that, the opportunity for donation is so rare. Less than 2% of people die in a manner at any given moment that makes them viable for organ donation. And so we're going to talk to Amy about this to give us some resources and support and some understanding about living donation. And then Jelani's going to talk to us a little bit about his living donation process. And so Amy, can you do a couple of things for me? One, I've gotten some questions out of the chat box and they would like you to give the resources for transplants.
Yep.
Repeat that. And then
Great.
Tell us a little bit about your work and why it's important to register to be an organ, eye, and tissue donor.
Sure. Okay, so for everyone who's interested in the resources we're going to talk about today, there's two important websites, exploretransplant.org and explorelivingdonation.org. So pretty easy, right? So definitely go to both of those. And a lot of the things I'm going to be talking about are available at that site, so it should be easier. They're also generally true, very simple, so that if anyone has care at other places, this can help everybody across the country. So there are people on this call that I know have met someone like me at some point in their life. Jelani has met a few, it sounds like. So I'm a transplant educator, and I work with transplant coordinators every day to help people thinking about the option of transplant. So I really think it's beautiful because we're all part of a continuum. They're good people who pass away and they decide, you know what, I am going to stand for people who need organs. And those people are amazing and are transforming lives. And then there are people that are in need and they're coming forward and they're saying, can I get a transplant? What's the best strategy for me? And my commitment, you know, by coming on this today and any day that I work with any one person is I say it's really important to be as fully empowered as you can. And I loved what Jelani just said, because he's like, you know what? I got news. I had to get the information. I had to fight the good fight. And I think the important thing is to get to powerful resources and people who really have your back so that you can know what all of your options are. I think a lot of times we get a little bit scared. And I always say that I feel like where we're learning about transplant as a community is on shows like Grey's Anatomy. So like, I'm an educator. Every day I could talk to people, but nobody talks to me. But then they tell me how they saw in Grey's Anatomy that something terrible happened and they'd never do something. So here's what I want to say. Grey's Anatomy is a show and they pick scary stories to make it really interesting. Then there's the process of being a person interested in transplant. Hopefully not at all the same. And so I work in a much more boring world where our job is to assess people, to give them the information, and then to help them choose what's right for them. And so the key here is that you get your facts and then you bring questions to people who deal with this every day and they give you the information. And I always say you have to weigh the risks and the benefits of transplant. And then you have to think strategically. So what I love, Jelani, can you tell us more about your 5 kids? Because I get that those 5 kids got you moving when you were at a point where your first kidney didn't work. So what has you step forward?
Yeah, you see the artwork behind me over here? That's those guys. And I do want to say this. Yes, my mother did call me when that episode of Grey's Anatomy came on to tell me about it. And I'm like, Mom, you know more about Grey's Anatomy. You know more about transplant than Grey's Anatomy does. Don't worry about that, what they're saying.
Yeah.
I'm sorry, could you please ask me the
so
question
my question was, so you told us about your kids and you said at one point you go, these 5 kids are what kept me going. Like when you were thinking about your second transplant. So that pulled you forth when the going got tough, right?
Yes, and even when I was on dialysis, I would have I'd have people that weren't related on dialysis necessary asking that question, but then the individuals who were there with me, who were sort of captive to their own fear, and they would say, "Well, how do you do it?"
Yes.
And I would go, "I don't have a choice. I have these other individuals whose lives are based upon my effort. So I don't get to stop and think about the weight and the gravity of everything because I know that I have to keep moving forward. And it's not just for me that I'm carrying other individuals with me, not just my family, but then those dialysis mates that didn't make it. So those that are not here to speak. So of course I have to keep moving because it's like I said, it's not about one person. It's a larger community involved here.
Yeah, thank you, Jelani. Because the thing that I want to underline about what you just said is there's 2 things. You know, this is, you know, we're in COVID, all of us, right? Welcome to my house, right? We're all here doing the best, right? And the feeling here is like the situation of COVID is hard, healthcare is hard, health challenges are hard, right? So what keeps us like going is that there's a reason bigger than the challenges, because the challenges keep growing, right? So for Jelani, it was both, what I love is it was both your family and being there for your family, but second, it was for being a voice for this, right? Kind of like really not, there are people that are no longer with us and you said, hey, if this can help somebody. And I feel the same way. And what I want to say to everybody who's on the call is thank you for learning. right? You've got to learn about this, and then you have to decide and strategize and stay safe and go forward. But a lot of why I talk about living donation is that living donation is often a way to get a transplant more quickly. So in California, the wait for a kidney is 7 to 10 years for a deceased donor, just because we don't have enough organs donated every year. And so then a lot of times when I talk to people, they're all interested in getting on the list to get a deceased donor transplant if one becomes available. But the other part that I say is you need to strategically be thinking about whether you would talk to friends and family, that you had anyone who would want to learn about this, because the second way to increase the number of kidneys available for transplant is for living donation. Do you guys know how many people donated a living donation? How many people gave one kidney while they were alive last year in the United States? Does anybody know that data?
No, tell us about it.
Yeah. So about 6,800 people in 2019. Wow. Isn't that amazing?
That's amazing.
Good people didn't have to do this, went through a surgery they didn't have to have. So the beauty of the people that pass away and their families who stand for the greater good, and the beauty of these 7,000 people every year who donate one kidney are just amazing. And we're part of the whole scope. So so we'll talk more about living donation, but I just wanted to say for everyone, they need to choose if they would be a donor when they pass away, but also would they ever, if the need became in front of them like Jelani, would they ever step forward to donate one kidney?
And which is so interesting. So I live in Chicago. My family is addicted to Chicago Med, Chicago PD, and Chicago Fire. I have worked at Gift of Hope for 11 years. And to your point, Jelani, I have to say, stop calling me with that. Stop watching that, because you are not getting the true information, and you do know more, right? And especially when we have more than 90,000 people waiting for a kidney. Just imagine if 90,000 people gave one kidney. We could have wiped that list out. Yes. You know, that's the important thing. It's just so selfless, and you can live with one kidney, right? And even though OPOs are the stewards of donation, we're the stewards of the donation process for deceased donation. And it's been very gratifying to see the relationship between living donation and deceased donation collaborating more, sharing the stories so that we can help each other out. Because at the end of the day, donation is donation, no matter how it happens. And that's where we want to go, to help people to really see another day. I mean, just look at Jelani. 5 children, you know, he sees them every day, and look at all the milestones he's had, right? And so I think that's very important as we start to educate and keep people focused on donation, because, you know, 8 lives, one donor can save 8 lives and heal more than 75 with tissue donation. And so we want to make sure that people understand that. They understand the process of donation, right? Because to you all's point, these television shows are given a false sense of reality about donation. And we as a community have to really do our parts and get out to these people who, you know, are telling these stories. Yeah, sensationalism is great, but we're talking about something fantastic here, and that is saving lives. So Jelani, from your standpoint, can you tell me a little bit about why it's so important to register to be an organ, eye, and tissue donor?
There are actually several benefits. One of the first ones is I mentioned it earlier, it's an opportunity that if ever someone needed, you know, a gift that we have to help, you know, help their life continue when we no longer need those gifts. That's one of the major things. I did not expect to be on this end of the spectrum. I actually signed up to be an organ donor prior to this happening to me, and that speaks volumes. Mm-hmm. One of the other things why it's so important is those individuals that we're saying yes to the opportunity to helping. Shortly after my second transplant, my neighbor came to the front door. And she was in a panic. Now she's a reservist, okay? And so she's not a meek person by any means. And she was in a total panic because her child was locked in the car in the middle of summer here in Bakersfield, where it gets up to 104, 105 degrees. I broke through the window. If those 2 transplants and everything that had transpired hadn't happened, I would not have been there to do that. And so there's all this residual benefits that can come for signing up just to saying yes to the opportunity. So that's why it's important. There's a lot more that we can do, and there's some good people behind this that we can help. So.
And tell us a little bit about your second job, being an ambassador for OneLegacy. Tell us what that's like, and how do you help communities of colors to really understand the process of donation?
Specifically for people of color, when we go through and we have medical issues, we are not always represented in terms of the individuals that are helping to provide the care. And so that also builds to some of the fear, because there's some sort of lack of trust there, because it's like, well, I understand what you're saying, but it's not coming from somebody that looks like me and talks like me. So as an ambassador, when you can go out into the community and they can see, oh, okay, well, this is about everybody. Literally, it's about everybody. And so as an ambassador, it's our job to be the public face and to get the right information, not Grey's Anatomy, to get the right information into the hands of individuals face to face. Because it's nice to be on TV and on a commercial to give some information, but when you have that in-person contact where you can look into somebody's eyes and see whether or not they're being sincere, to read off of their, those unspoken cues, that makes a difference. And we see people sign up, in these meetings where they never thought about it, where sometimes these are individuals whose job it is to provide care, and they sign up because now they have the accurate information and they meet what happens on the other side of the process. Because for some of those individuals, they don't know what happens next. And then when they get to meet somebody who's living and doing well, and wouldn't have known that he had 2 transplants, that makes a difference.
Yeah, I'd love to add something too. What I noticed, the same kind of things happens on my side with transplant, that I'll be talking about transplant and people will be like, no, I can't get a transplant. I'm on dialysis, but I have diabetes or I have high blood pressure, so I probably can't do it. Like, you're sitting right here, you've had 2 transplants. So what I feel is people decide, they make up things, and with the myths that are part of our society, it's understandable. And then they go, no, they rule themselves out from thinking that they could get a transplant or 2 transplants. So I always say, let us tell you at the transplant center. If you're curious, if you could get a transplant, talk to your doctors, go call a transplant center, say, can I get evaluated? Because then they'll tell you the actual medical facts if you're healthy enough to get a transplant, and if it'll help you versus what you're, if you're on dialysis. A lot of that to me is people, the other piece I see in terms of a barrier is that sometimes people know all these people on dialysis, right? And they say, well, everyone I know is on, I've got a whole community. My family has this in our family. So this is all that this is our choice. And I was like, okay, that's part of your family. Isn't it great we have dialysis? I always say that. But also, did you know that other people in your family could have had the option of transplant maybe and didn't take advantage of it in time? Or do you want a transplant? So there's a sense right now that we just, people are getting transplants every day that are as diverse as the human race. And if anyone wants to come to our transplant center at UCLA or any of the other ones, I know, speaking on behalf of transplant, we would love to evaluate you. Everyone deserves equal access to the best treatments.
Absolutely. Absolutely.
Yeah. And, that's so important. So as Tiffany mentioned, I'm the president of the Association for Multicultural Affairs and Transplantation, which is AMAT, and it's made up of organ procurement organization staff members and people who are interested in donation. And we really talk about how we can support the transplant industry, because, we have all the staff that is a part of our membership that is focused on multicultural outreach and focused on education and outreach. And so we're uniquely positioned to work with transplant centers to have that conversation about what the needs are for multicultural communities, but more importantly, how to have the conversations with them. So with AMAT, we encourage people, one, to become members. We're going to have AMAT week in September 14th through the 18th, where you can get more information about multicultural donation. But more importantly, as we talk about bridging the gap between diversity and inclusion in healthcare, you know, the other talking point that Jelani brought up is that there have to be people in the room that look like the people are getting the treatment. And so as an industry, we have to be intentional on how we hire and what the folks look like, who are going out and who are going into these rooms and speaking to people. So we want to be able to make that as diverse as the people who are on the list and waiting. And so with that, Amy, can you tell us a little bit about your experience with minority donors and recipients? And you gave us a little information on Explore Transplant, but if you could just reiterate that one more time for people who may have been late joining us.
Sure.
I think that's a key point to talk about diversity.
Okay. So the key thing that that I think about, if you're interested at all in a transplant, just to give you the overview, and exploretransplant.org has a lot of resources. One of my favorites is called My Transplant Coach, where basically you can see little animated characters go to a transplant center and kind of go through the process of what you might expect. It's really simple, fun, you know. So the key to me is that you go and you learn about this information, because the key question that everyone has to decide is, can a transplant help me? You know, can I live longer? Can I have more freedom to do what's important to me? Can, you know, I go back to work if that's a goal? Can I work in a different way if that's a goal? So there's a sense of weighing what's important more than anything else. And what's great about our transplant centers across the country is that they're inviting everybody who is interested in getting a transplant to come forward. They can be on dialysis. Their kidneys can be problematic even before dialysis. You could say, hey, your doctors are telling you that your kidneys aren't doing really well. You know what? Go check out transplant in addition to what your dialysis treatments are. And then the point is to ask your honest questions. So just be like, okay, doc, what do you see the value of this for me is? How long would I be waiting? So, and then people are weighing their options. So they can, what's really interesting is you can get a kidney from a deceased donor. You can get a kidney from someone in your family or your friends, your community, your church community that you know, people who know you from work. It gets kind of wide and generous here. It doesn't even have to be a person of your same race. So that's the thing. Sometimes that's a misunderstanding. It just has to be somebody whose blood type and antibodies match you enough that when the kidney goes in, it doesn't cause your body to want to reject it. The other part, we used to say that we need to find someone who matches you, but we actually don't even do that anymore. This is fascinating. So for people who have a loved one who wanted to donate to them but didn't match, now there's even the process of people can go through a process where they find other pairs like that don't match, and then they swap and they give a kidney to someone they don't know, and this person gives, and then there's now multiple people in a chain or a swap that are benefiting. So transplant centers know about all of this. So if anyone who's listening says, I'd love a transplant and I was a little bit scared to get evaluated, I would say knowledge is power. Go forward, get the facts, and learn about all the different treatments that might benefit you and all the different types of transplant. And then for people who might have had someone who loves them that said, oh, I don't think I'm a candidate to be a donor, or we got a little bit further and our blood types didn't match, call again and say, I was listening to Amy and she said there might be a way that we could be part of a chain program or a swap program, and see if that's possible, because these in the last few, like 10 to 15 years, have been causing living donation to increase and increase, because generous people have been stepping forward the whole time, just some of them didn't match. So those are just some things as a general coach that I would say, in addition to going to Explore Transplant and learning all you can.
Thanks, Amy. And so, Jelani, as we start to think about our closing, can you tell us about your experience? One, did you know your donor from your first kidney? And then who was your living donor? And tell us about that experience.
So I did not know my first donor. I received a deceased donation, and we come from two culturally different backgrounds, and which to contrast with my second transplant, it's actually from a relative of mine, and we are of the same ethnicity. And I view them both with the same reverence. And I could see when these statistics come out, it's like, okay, well, if you find a match that's closer to you, to your ethnicity group, you'll have, more success. And
Absolutely.
so I'm actually, living and breathing proof of that. But yeah, I knew my cousin who
Mm-hmm.
donated to me for
Mm-hmm.
through
And
living
how's your
donation.
cousin doing?
He's doing well. He's doing well. He just got a new job, and so he's super happy right now. He's got he's raising his son, and so
Mm-hmm.
everybody is, we're having birthday parties and Christmases, and it's almost like we didn't experience the previous 10 or 12 years.
Mm-hmm.
But
And did you
go ahead.
have a chance to rate your donor family?
I actually, before all this happened
Mm-hmm.
with COVID-19, the previous run walk, I found my donor's photo,
Mm-hmm.
and his family wasn't there at that particular run walk, but we had been apparently rubbing shoulders at these run walk events, and they weren't there because his eldest daughter had graduated from college and she's going into special education, and so they were in Arizona and they missed the event. But yes, I've been in contact with my
Okay.
first donor family.
I will tell you it's important. My daughter and I received just right before COVID, actually a letter from my husband's cornea recipient. And so we're in the process of writing her back. But I think it's important to give honor and grace to your donor families. And I'm not speaking just because of my experience. I manage donor family services. And so that's what we do. We take care of the donor families after their tragic circumstance with donation. And so, but I think it's a way to tie in the circle of donation, to be able to have donor families and recipients meet, so that you can see the continuation of life and create that lasting legacy for the donor. And so I think that's great. And so Amy, I'm gonna see if you guys have one last comment that you'd like to talk about, if there's anything else you'd like to include that we haven't included. And then we're going to take, in about 5 minutes, we're going to take in some questions and answers, because we have quite a few in the question and answer chat box. So we'll get to those. So Amy,
yeah.
Go first.
Thanks so much. So the last thing I wanted to say is my list of resources is, I am so excited, and I think you guys who are on this call already get it, but hearing stories of people who are facing these decisions and hearing stories of people who decide to be donors is incredible, moving. You never forget them. That's what I've learned being in this field for so long. So we created the Living Donation Storytelling Project, and I wanted just to take a moment and show you guys the trailer for this, because I wanted to both invite, I've got a lot of ambassadors and people who might be part of a living donation story that might want to tell their story. I want to just say that we have a library now of online stories you can go to at Explore Living Donation, and I'll just give you a hint of it now, if Gavin could play the video.
My name is Katie Walker.
Hello, my name is Richard Hicks.
My name is Matt Ronan.
My name is Susie.
Emily.
My name is Diane.
And I donated a kidney to my cousin. And I donated my kidney to my brother Carl.
I donated a kidney to a stranger.
I had the honor of donating my kidney to my daughter Monica. She was 3 years old at the time.
I was motivated to donate a kidney to my brother because of, one, what he was going through, and two, that my brother needed a hero.
It was really powerful. It was a powerful moment to see somebody go from so sick to looking so much better in such a short period of time.
It was, words just can't describe it. She just and her color was back, and she looked so good.
The best moment after my surgery was on a Saturday. My brother came downstairs. I was eating breakfast and kind of doing my thing, and he said, "Bro, guess what?" And I said, "What?" And he said, "I don't have to go to dialysis."
I would just encourage you to remember that a very short interruption in your life, a matter of days or weeks, can make the difference in the rest of someone else's life.
Awesome. Thank you. It's a great video.
Yep. The key thing that I just want to invite people is that it's really important when you're facing these challenges to meet people who look like you, fundamentally, right? I can only say what I can say, but when you meet Jelani, it's different. And it's people who are facing the same challenges. It's people that can speak much more in a wise way to the challenges. So I just want to invite people to go to the library. If you want to contribute your wisdom, you're also invited to be part of it. You can tell your stories on your phone, and then they go as part of the library. So thanks, everybody.
Awesome. Jelani.
If I can leave everyone with something, it would be this solution to moving forward: self-education. How important is it for individuals going through this process or knowing someone that's going through the process? I'm still going through it. Yes, I'm a success story, but I have other health issues that I have to deal with. It didn't just stop after the transplant occurred. And so I was actually able to make a decision recently where I went plant-based to help heal my heart. With my last follow-up with the Transplant Institute, we found out that the kidney is actually performing better because of that choice. So self-education, just keep learning, and don't become a Google warrior, but continue to find those resources and those individuals, and you'll find a way forward.
Great. Okay, the first question is for you, Jelani. Someone wants to know, how did your body feel at the first sign of kidney failure?
I didn't recognize it at first. I was tired, kind of fatigued and lethargic, but just in the sense that I was tired, but not aware of the impact that was happening internally. So it started with fatigue.
Okay, great.
The other symptoms, if I could add a couple more, sometimes people, their legs start to swell and they can be nauseous. So those are symptoms to look out for. And you can also just be monitoring your kidney function with your doctor, but those symptoms start to happen as your kidneys are very serious. They're not working.
Amy, this question is for you. Are there any relation between kidney stones and kidney failure?
Not directly. Kidney stones can be problematic, and you should be working with a nephrologist if you have a regular occurrence of them. They're not necessarily leading to kidney failure, though. They're just different things.
That's true.
Okay, and then Travis is asking, what is the greatest need or barrier for minority communities to donation, and how can he help? I think Amy and I can both answer this question. The biggest barrier, there's several, is that mistrust for the medical profession and the healthcare profession is one of the biggest barriers for minorities and wanting to donate, because they believe lots of myths and misconceptions. And so we always try as a community to have them learn the truth from us. That's why this podcast, this webinar is so important, that people can come here and get information about what is true. Yes, we know that things have happened 60 years ago in the medical profession that was not kind to minority communities. We recognize that. But we also know that the medical field has evolved in the last 60 years. And we really have an opportunity, as Amy mentioned earlier, to help save lives. We can help get you out of the situation you're in, that is dialysis, and then we can do all the other things that people have concerns about from a religious standpoint. Yes, we bury healthy organs every day. Think about the 157,000 people that have died. And if we would have been able to save those organs, we could have gotten people off the transplant list, right? But we couldn't because of COVID. Think about questions that they have about having funerals and having open caskets. And those are things that are questions that we can answer. But the biggest one is the mistrust for the healthcare community. Amy?
And I would actually flip it, since we're at the solution point of this. Here, the thing that you said at the beginning that I think is really important to underline here is we have over 300 million people in the United States. And if we had 110,000 people, 90,000 people who need kidneys, who donated one kidney, we'd be done. And I always say there are 90,000 charitable people in that 300 million group. So how can we transform the public conversation in each of our individual communities, in our church communities, in our in our racial and ethnic communities, in our, you know, in the news, in all of this. How can we bring this positive story of what we can do for each other out, especially in this time of COVID, where everyone's saying we should be siloed? Look, we're a beautiful like story right now of human empowerment, and I feel that we need a visible public message transformation that living donation's possible, that good people do it every day.
Mm-hmm. Amy, someone says, today is the first time I've heard of Explore Transplant, and could you discuss why it was started and how the information is spread?
Sure. So I work at a transplant center, and how this all started years ago when I was a little string bean in the field was that I heard that a lot of people were interested. They appreciated the opportunity to be a living donor, but they did have some questions and fears, and no one had talked about it. They were a little shy to bring them up, and they said, could you just design education that could help resolve the common questions that we're having as potential living donors? And I was really moved, and I started a program that led to a nonprofit. And then this program is available now nationally. Transplant centers use it. Dialysis centers have brought it in. OneLegacy has supported trainings using the Explore Transplant resources. And so my commitment is, as we've all said all day, equal access to information. Information is empowering. And then if you're interested in transplant, you can then be referred using that site to a transplant center near you. So it started a long time ago.
Thank you. I'm going to have to turn this over to Tiffany, but the only other questions we had left, they're really not questions, is Cheryl LaPlante says that her sister was transplanted at UCLA. She donated a kidney to her brother at UCLA. And then Aiken says that his stepdad, who passed away in 2013, was an organ donor, and his passing was able to save lives. And then the last just question is, Jelani, they'd like to know how your blood pressure is since the transplant. And then we're going to turn it over to Tiffany to close up, but I'd just like to say thank you so much for being wonderful guests today. This was an awesome virtual event, and I hope that as presenters you got enough out of this and that the wisdom that you imparted has been invaluable.
Thank you. Thank you. I guess I'll go ahead and answer the question. My blood pressure has improved greatly, especially since I went to a plant-based diet. So my numbers, we don't even approach hypertensive. My blood pressure is normal, and the medications that I'm on are greatly reduced compared to being on dialysis. So I'm doing good with that.
Hey, Tiffany, thanks so much for having us today.
Thank you. This town hall was very informative. I think that everyone got a lot out of it. I did. I was sitting here writing down notes as I was listening. And I just really want to say thank you all for just making this come to life. Thank you, everyone out there who has joined us today. I want to reiterate that this platform is created for you. This platform is created so that we can hear from you. And while we heard a lot talking about storylines in Hollywood and, not always getting it right, I want to take a minute to say that OPO and the OPO community understands the importance of storytelling. And so Donate Life Hollywood is an initiative of the OneLegacy Foundation. And their mission statement is actually that DLH, or Donate Life Hollywood, helps tell authentic and empowering stories about donation and transplantation. And they work directly with writers, producers in Hollywood. So let us know what we can do to bring more stories or other town hall topics to you. Please feel free to submit, and we'll have a questionnaire that will come out after this. And please share with your family the importance of organ, eye, and tissue donation. I just want to say that my father had congestive heart failure, and someone else gave him a second chance. So now we get to hear his heartbeat. He gets to be on phone calls with our family and hear from us. So it is important to make sure that we're sharing with our families and our friends the importance of organ, eye, and tissue donation. And then we'll see you next time. Thank you.